Hi class, welcome to EdVantage. I'm Dr. Jody Richardson Delgado. Today we're going to be talking about therapies. Now, we're going to start with behavior therapies. We talked in the previous video about insight therapies, and the idea of insight therapy is gaining insight. With behavior therapies and the other therapies we're going to talk about in this video, we're not necessarily interested in gaining insight, we just want to work on the problem. So with behavior therapy, this is based on learning principles that we actually talked about in the learning chapter. And we use those principles to help with maladaptive behaviors. So we might use classical conditioning. Now, with classical conditioning, we can do something called systematic desensitization. And this is where we would have a client think about an issue, maybe a phobia that they're dealing with, and think about different scenarios that they are in on a scale of 1 to 10. 10 being the most distressful and 1 being the least distressful. So 10, maybe they have a phobia of elevators. A lot of people have fear of elevators. So getting on an elevator and having to go up 22 flights of stairs is a 10 for this individual. Just seeing a picture of an elevator might be a 1 for this individual. So this is where we would systematically work with this individual to help them kind of deal with their anxiety when they feel this. So we might start at a 1 with showing them the picture of an elevator. How do you feel? About a 1. Okay, so now we walk over and we actually see an elevator and just look at the actual elevator. Now we're getting up to maybe a 3. And so we start to deal with the anxiety that comes up with that. And then maybe we go up and actually push the button, and now we're up to about a 4. Now we ask the client to actually get into the elevator, but not ride the elevator. So you see how this is systematic, and we're desensitizing where, okay, this was scary, and I thought it was going to be really scary, but I'm here and I'm okay. And maybe we do going into the elevator and getting out a few times before we move up into that 10 of actually riding up 22 flights of stairs. But the idea is very systematically going through one by one all of the fears that someone might have, so eventually, hopefully, they can actually ride the elevator to the 22nd floor. Another type of classical conditioning would be aversion therapy. And this is where we pair an aversive or unpleasant stimulus with a maladaptive behavior. So this might be putting some type of medication or something in a drink that makes us feel nauseous. So maybe an individual has a problem with drinking too much, and their favorite drink is beer. So we would put that substance in the beer and it would make that individual feel nauseous. And this may have happened to you. Think about maybe the last time you were sick and threw up. What was the meal that you ate right before that? And didn't you kind of have an aversion to that meal for a few days, if not for a while after? I know for myself, when I was pregnant, I certainly would get a little nauseous around Doritos. So I still to this day have some issues with the smell of Doritos. And that's just this form of classical conditioning. Another form of behavior therapy is modeling. And we know that watching others really influences our behaviors. So watching and imitating models that demonstrate desired behaviors. And so when we see others help other individuals, we're likely to help others as well. So there's pros and cons to behavior therapy, just like there are with all therapies. The pros, it doesn't require insight. It's shown to be successful for things like phobias, obsessive compulsive disorder, eating disorders, autism, and intellectual disabilities. Some of the cons, how do we generalize this to the real world? If I'm in this therapeutic setting and it's safe in here, how do I generalize this? So for the example of putting the drug in the beer, well, if you have a problem drinking too much and beer is your drink of choice, there's nothing stopping you from going to another type of alcoholic beverage. So that can be a problem. And then there's ethics related to controls. We really cannot classically condition someone without their knowledge. So that's an important factor that we need to take into consideration. Other forms of therapy are biomedical therapies. The 3 forms of biomedical therapies that are most well known are electroconvulsive therapy, psychosurgery, and psychopharmacology. Now, electroconvulsive therapy came about, and this is where we hook an individual up to electrodes, and we actually send an electrical current through their body. It's not exactly known how this works and why it works, and it's often used as one of the last interventions for individuals. And it's most often used today with individuals who have severe major depressive disorder and medication has not worked for that individual. And there's still centers around all over the United States that do this form of therapy. And often what they'll do is they'll hook the electrodes up and they'll send a slight current through the body. And what you used to see in films and in the media were these wild convulsions that individuals would have. And that's actually not the case. You don't see those wild convulsions. It's very controlled today. Some of the issues, though, with ECT are some memory loss. Often the memory loss is right around the event or the day of the event, and that can be a problem. However, some people have reported a lot of memory loss. Others report that that's just a few minutes or a few hours of time, and they have had great success with ECT. Psychosurgery started as lobotomy back in the 40s and 50s, before we had medications. And the first type of psychosurgery was where we would sever the corpus callosum, and this would cause a great amount of damage to the brain. And these individuals may not have suffered from whatever the issue was that they were dealing with, like schizophrenia or something like that, but then they had other issues that went along with that. This started to go away as medication was introduced, and it's not done in that way at all anymore. Today, we do have psychosurgery available, and it's where lasers are used in specific areas of the brain, and it's most often used with individuals who have obsessive compulsive disorder. And again, it is used as a last resort because they have to be very precise in where they are putting these lesions with the laser, and we can't reverse it. Now, psychopharmacology is one that is used quite a bit today, and it is an area that is expanding in psychiatry. There's 4 major areas of drugs that we use in psychopharmacology. We have anti-anxiety medications, antipsychotic medications, mood stabilizers, and antidepressants. Now, with anti-anxiety medications, these medications are used to help raise the GABA in the system and therefore help an individual who might be experiencing a panic attack. Antipsychotic medications are those medications that really treat the positive symptoms that we were talking about in the last video on abnormal psychology of hallucinations and delusions. So an antipsychotic medication can be given to an individual who is diagnosed with schizophrenia and is experiencing hallucinations or delusions, but it can also be given to individuals who have another diagnosis but are still experiencing hallucinations and or delusions. Mood stabilizing medications are those medications that really help stabilize the mood, so help bring down the mania or the manic episode of an individual and help stabilize some of the ups and downs that someone with bipolar disorder might experience. Antidepressants have gone through several generations. We started with tricyclics and moved quickly to MAOIs. Now, MAOIs are those medications that really work with the enzymatic breakdown of the neurotransmitters. We talked about this in the biology chapter, and this is where the neurotransmitters, remember, they're not free floating in our system, right? So they are either distributed into the receiving neuron, or they're taken back up by the sending neuron, or these enzymes come in and actually break down the neurotransmitters. The MAOI works with the enzymes and actually helps neutralize them slightly, and so the serotonin can stay in that gap that's between the 2 neurons a little bit longer, therefore allowing more absorption of the serotonin. The problem with the MAOIs, and why we've moved on to more recent generations of the SSRIs and the SNRIs, is that it was easy to overdose on this medication. There was a lot of side effects such as weight gain. You had to be on a very special diet because if you ate something like meat or cheese, it might interfere with the way that the enzymes were neutralized. So people would start taking these medications and very quickly go off of them. So we introduced the SSRIs, the serotonin reuptake inhibitors. And you can hear from that it's going to inhibit the uptake of that neurotransmitter serotonin. And so if I can't be absorbed back up into the neurotransmitter that's been sending it, then I have to spend more time in that gap between the two neurons, and therefore more serotonin can be absorbed into the receiving neuron. The SNRIs are very similar. It works with other neurotransmitters as well. These medications also have some side effects to them. So again, we're dealing with some sexual side effects, weight gain, sleeping and eating can also be disrupted with these medications. So we're constantly working on new medications, mainly because of the side effects that are experienced, and also we want to come up with medications that are the most effective for individuals who experience depression. So when we're looking at therapy, we do find that the majority of people are better off and report being better off after they have been through therapy or are currently going through therapy. When finding a therapist, it's important to make appointments with several therapists. Don't go with the first one just because that's what's covered with insurance or that's the only thing that you can find. You really want to find someone who is using techniques that make sense to you and that you have a rapport or feel like you can form a rapport with. Don't settle. It's really important not to settle for individuals. If you feel like you're in crisis or if someone is in crisis, there are a lot of different community resources as well as crisis hotlines. I've listed one here in the slide for you if you need it or find someone else in your life that needs it. And that's important as well. We do find that people who are trying to help others that are dealing with very serious issues can have helper's fatigue. And this is important for the helper to seek help for themselves. So they may find that they need support from community resources or a therapist themselves. So thank you for watching. I hope this video has helped. Please click on the EdVantage logo to subscribe.